Hello, everyone, and welcome to COM 363. I am your instructor for this course, Dr. Jonathan Dellinger. Nice to meet you, kind of. I will be providing these video lectures throughout the course to help you get a little deeper in depth about the content from the textbook, but also to elaborate on some of those concepts and hopefully contextualize them and make them a little more meaningful for you in your day-to-day life. So let's get into it with this first lecture covering chapter 1 of the textbook and some other thoughts in addition to that, so we can start wrapping our heads around what is health communication and why it might matter to you in your careers and your personal life. Let's begin by talking about the example I asked you to engage with on the discussion boards for week 1. Now, this is a current example. Obviously, coronavirus is an ongoing pandemic from 2019 until question mark, right? And perhaps the most pressing example of public health we have is the engagement of these public health officials with the public. So the example I asked you to look at what came from Slate magazine, and it was discussing Anthony Fauci, Dr. Anthony Fauci, the chief medical advisor to the President of the United States, director of NIAID, National Institute of Allergies and Diseases, and he was kind of thrust into this position where he was the spokesperson for our public health efforts regarding the pandemic, and he got a lot of flack for it. And he kind of made some mistakes, arguably. But this article was talking about specifically his health communication with the public, very specifically the fact that he told, well, literal lies, right? It was information that was designed to lead the public in a certain way towards certain health decisions, but it was misleading information at times. And so, well, that introduces an ethical dilemma, which the article refers to as a noble lie. Now, we need to ask ourselves how much we care about this. The article authors introduced this idea to say, well, it's not okay to lie to the public because it violates trust. We want to play with that. Let's take a look at our questions and see what we can come up with here. So here are the questions I posed to you, and I asked you to discuss these in greater length on the discussion boards. We don't have to go into every single one of these, but we can certainly consider that. The first and foremost important question, I mean the first and last really, what I'd like you to think about here is, when, if ever, is it okay to lie? You could think about that generally, but you can also think about it more specifically, and well, obviously that's kind of the point of the class. When is it okay to lie about health, health communication, health choices? When is that okay, if ever, and why do you think so? And then the rest of these questions kind of have to do with what kind of lessons we can take away from that observation, what factors might be beneficial to us as health comm scholars to take forward into health interventions or our day-to-day life or anything else you think of along the way. I was pleased to see people actively engaging with these ideas on the discussion board, and we had a representation of people saying, well, it's okay under these circumstances, or oh, it's never okay. And I recognize that I'm kind of backing you into a corner, right? And you may be in a position to defend something that maybe you're not super comfortable with. Well, hey, that's welcome to the world of the health profession, right? Right. Welcome to public health. Maybe you have to make some choices, defend something that you're not 100% behind. Sometimes it's a moving target, right? That's one excuse often given by public health officials these days. Well, the science changes. We're following the science. Our knowledge develops. And to a certain extent, that's true, right? This is a novel coronavirus. We weren't entirely sure how it spread, what it did, who's vulnerable. Those questions were answered as we went along to some extent. But now think about that, though. At the beginning of the pandemic, there were about 2 weeks where we all seemed to agree, right? We're all scared and everyone was trying to cooperate. And then it went through the media cycle and all of a sudden everyone's got an opinion about it and everyone's got the right opinion about it, right? And that opinion suspiciously aligns with their political affiliation and what people are saying about that. Well, one of the goals of this class is to try and break that habit. And that's going to be kind of the punchline of this particular lecture, is that health is not and should not be political, but it often is, right? And health communication, public health is often politicized, and just like everything else, it gets politicized. We can engage with that question too, though, whether or not you think health should be political. I bet politicians would say it should be political because it's too important not to be. However, when it comes to health choices, we're going to find that it's hard enough to know what a meaningful health choice is for your own well-being, and politics don't often help with that. So let's consider this first question. When, if ever, is it okay to lie about health and health choices, and why? Here's the conclusion of the article authors, which most of you seem to agree with, though we did have some distance. Some people say, sometimes it's okay, and for this reason. But they are claiming that noble lies are a trap. So what's a noble lie? Well, a noble lie would be a well-intentioned lie. Right? We could probably agree that uh, public health officials, and in this particular example, Anthony Fauci, he probably meant well, right? We could agree on the best of intentions. However, the article authors say those well-intentioned lies are a trap, right? They seem like a good idea, but they're a problem because they violate public trust. So here's the conclusion from the article. They said, noble lies are a trap. We cannot predict the public's behavior, and the loss of trust is devastating. The general population is far too skeptical to blindly follow the advice of experts and far too intelligent to be easily duped. Now, you are entitled to agree or disagree with that statement. Maybe you don't think that the population is smart enough to know that they've been tricked, or maybe they do follow the advice of experts. But this idea that of violating public trust is an important one to consider, and I think most people hit on this in the discussion boards. If you violate the trust of the people you are trying to convey meaningful health information to, it doesn't matter if you're right or wrong anymore because they're not going to listen to you. That is probably the most important lesson we can take from health communication, is that the health information, even if you have the best health information, you need to get it to the people who need that health information, and they need to then act on it. You can't force someone to act on it. That's an important lesson, and it's one that a lot of people, a lot of public health officials and administrative officials and government officials seem to have forgotten in the past several years, is that you can't really force people to make health decisions. Thus, the noble lies are particularly dangerous in these kinds of situations of public health. If you do not have the public's trust, they're not going to pursue the health intervention for good or bad. That's not really engaging with the other questions, right? There is a lot of uncertainty regarding the pandemic, regarding the coronavirus, regarding the safety of the vaccines. Some people say they're safe. Some people very strongly say they are not safe, and we don't know how they're going to act in the population. And these are questions that are too important to sweep under the rug. We should probably be discussing these things, but the fact of the matter remains, we've seen this play out a little bit in the past couple of years. A lot of people, for better or worse, are not prepared to simply follow what Anthony Fauci says because he's Anthony Fauci, right? We didn't even know who he was until this happened. So it's going to take a little bit more than good intentions to have meaningful health interventions. And that's lesson number one. So when, if ever, is it okay to lie about health and health choices, and why? The authors say it's not okay, and for the reason of violating public trust. You can probably tell I kind of agree with them on that, but we all have to make our choices. And if we do decide to misrepresent information or lie outright or something else, deceive in any other way, we need to be prepared for the consequences. Right? I'm not going to tell you to never lie or anything like that. You have your own life, and just like you can't, public health officials can't force people to make health decisions, I can't force you not to lie, but I might be able to convince you that it's got some consequences, right? So if you lie and you're caught, then it violates trust. If you violate trust, then it's going to interfere with meaningful communication, particularly on something as important as health communication. And once trust is lost, it's really hard to get back. So maybe that's enough context for you to start grasping the significance of health communication. Let's take it a couple steps back and make sure we've got a firm foundation to build the rest of the class on. So what is health communication? Maybe we should start with this. And to explain what health communication is, we should probably explain what regular communication is. This is the definition I like to use. communication can be thought of as the study of any site of human interaction. That may sound hugely broad because it is, and that's part of why you have comm scholars that do all kinds of different stuff. You've got your kind of composition type people who do study rhetoric and public discourse and things like that, and then you have your social scientists like myself that do statistical analyses and survey work and all that, and do our best to reproduce the scientific method in social context. Well, there's a lot of different ways in which humans interact, and so there's a lot to study. That's good and bad news for you if you're a comm person, right? There's a lot of questions that still need to be answered about communication, and there's a lot of specific sites of interactions that you could study as you go forward. That's neither here nor there, though. How do we translate that to health communication? Well, we're talking about contexts that are intended to or may influence health and health choices, and so health communication has to do with that. Still a little too broad for you? Well, we can go down to the textbook's definition of health communication, borrowed from Krebs and Thornton. The way we seek, process, and share health information. Maybe that's simple enough for us. But at any rate, you get a sense that a lot of things can fall into this category, whether it's a phone call with your parents and they ask if you're eating well, or a telehealth appointment with a healthcare professional you've seen many times before or never before. Or if it's just a tweet from the CDC going through your Twitter feed, right? These are all forms of health communication, and these lessons apply to almost all of these contexts. We're going to spend the course exploring those to greater depth. Now, why does it matter? Hopefully we have some sense of that by now just from our introductory kind of exercise, but health communication matters for a lot of different reasons. And hopefully you can make use of these going forward. You all have different lives to lead, different careers, but it should be useful either way. Now, first and foremost, the success of healthcare depends on clear communication. As we mentioned in the introduction there, it doesn't matter how good your health information is if people don't listen to it. And so if you're a doctor trying to get your patient to complete a course of antibiotics, regardless of their symptoms, well, you're going to have to convince them to do that and under some circumstances. Some people will just say, okay, I'll follow that, but some people won't. And the health outcomes depend on that successful, clear communication. It also helps healthcare organizations operate effectively. Perhaps you or someone you know is in the healthcare profession. Maybe you will be someday, but when you get there, or if you never do, or even if you're just a patient, you're going to see inefficiencies in the system. And so good, clear communication is essential to improving the systems within which we operate. Now, media, social or mass media, provides both good and bad information as well, and we want to be able to tell the difference. That seems to be getting a little bit more challenging as time goes on. We have a lot of information available to us. That's not the problem. The problem is figuring out which information is meaningful, which information is true, which information is pursuing someone else's agenda or supporting that, which information is just coming from a Twitter bot, you know. These are kinds of questions that we may never have clear answers to, but we need to try to answer those questions and kind of refine some strategies that can help us sort through the information. Now, good communication can improve confidence and comfort as well. This is a general observation about communication perhaps, but health communication especially. You'll be more comfortable and confident in interactions with your doctor, with your children, with your parents, with your family members, loved ones, spouse, whatever it may be. Good communication is essential to that aspect of your everyday life. Good communication also saves time, energy, and money. Hey, that matters, and it also matters for your career growth. So being able to pursue all of the goals that matter to us, both for health and professional and personal lives, well, it all depends on clear communication. But maybe we need to take another moment to think about what health is actually. What is it, right? What do we mean by health? Well, we tend to think of health as fixing something that's broken. And this is in the West, particularly Western culture, that's this positivist tradition in which we view our health as this kind of homeostatic thing where it's either good or it's broken. And if it's broken, we need to fix it. But not everything can be fixed. This is kind of a West-centric view. and it doesn't really capture some of the most important aspects of health. And so our opinions about health and healthcare have evolved a lot in at least my lifetime. And we're trying to view things a little more holistically these days, either in the pop culture sense or otherwise. But the WHO definition of health from 1948 would be a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Do you like that or do you not? I have mixed feelings about it. It seems a little utopian, right, to say that you could even have a complete physical, mental, social well-being, like this big package. Well, I like that it's capturing some of those less concrete aspects of health, right? Mental health, for example, social well-being. But it might be a little too optimistic in the sense that it's assuming that this is possible. So now, I do like that this is consistent with kind of holistic perspectives. A lot of ideas about health these days are recognizing that there's more to it than fixing broken bones, right? You want to have a good, healthy diet, good mental health. These are recursive relationships. There's a recursive relationship between stress and well-being, taking care of yourself. It's not just a matter of having a virus or bacterial infection. There's so much more to health than that. And there's all kinds of examples of this. The benefits of laughter is great. The feedback, if you smile more, you're going to feel more positive. These things are examples of how health works. There's also harsher examples, such as how many people do not survive the death of a spouse for very long, or the death of a child, or something traumatic like that. A lot of people don't last for more than a decade afterwards. It's heartbreak is devastating, right? Anxiety, stress, these things can damage our health. Even though they're psychological, they can have profound impacts on our lives. So, and again, this definition, maybe it's a little too utopian. Perhaps it's a little unrealistic. And maybe we can think of health as getting by, right? I've got a friend in the healthcare business. He's a doctor in California who works very hard to promote general well-being, not just this fix-it attitude. And he'll say, well, maybe we need to recognize that some things can't be fixed necessarily, but the goal of our lives is to live them. And if we're doing that to a satisfactory level, hey, maybe that's health, right? So our thinking on the subject has evolved a little bit from 1948, and the healthcare profession is still adjusting. And what does this mean for health promotion and health behaviors? Well, we're still learning that. And then we also want to ask this question of what is the role of one's environment. The textbook is going to talk a lot about social determinants of health. That means things that are in our social environment, racial injustices, social injustice, socioeconomic standing. All these things influence our health and they play a role in our environment. Now, this kind of leads me to consider the textbook is raising the question of a systems approach. They mentioned that they take kind of a systems approach to healthcare. And what does that mean for us? Well, it's kind of recognizing the complexity, the holistic nature of health and well-being. And even if we don't have clean answers, it's good for us to recognize this, that health it's a lot of interconnected factors interacting. And that's part of why it's so hard to assess even something as simple as causative relationships between exposure to coronavirus and whether or not you get it, right? Even something like that should be very clear cut, but it's not always, right? We're talking about complex systems. So systems theory is it's kind of a biological analogy for either organizational systems or in this case health systems and just health in general. But the goal here is to recognize that there are systems and subsystems tangled together in complex ways. What does that mean? Well, it means a couple of things. It means that there are recursive relationships between people and the systems they operate in. We are shaped by and we shape the systems that we are in. Health is no different. And one of the implications of systems theory is that band-aid solutions rarely work, right? Just kind of slapping something on the system and expecting it to work. Well, that was like one of the criticisms of the ACA, the Affordable Care Act, that was kind of Barack Obama's legacy. Right? By the time they got that passed into legislation, it didn't really look like what it started out as, right? And so some of the criticisms were, well, that's kind of a band-aid solution, and in some ways it makes bigger problems because it's guaranteeing more business for the insurance companies or whatever it may be. At the very least, it helps us recognize the complexity of this stuff. Systems are resistant to radical change, as we can see with the healthcare system. We may all agree that it needs to change. We may disagree about how, but we probably think this could work a little bit better than it's working in our country. But systems are resistant to radical change. So it's hard to change the whole thing, radically restructure it and make it do something different, as illustrated by the passing of the Affordable Care Act, right? But the bright side is that means that relatively small changes can still produce radical results because they propagate through that system. And so maybe we don't need a radical restructuring. Maybe we just need a couple of little changes in important ways, as long as we can have a reasonable expectation as to what that's going to look like as it propagates through that system. But it requires an understanding of that big system to ensure that that's going to be more successful. Now, the textbook extends this discussion to think about healthcare models, and you can think of these as paradigms. A paradigm is a researcher's worldview. It shapes how we develop theories, how we ask questions, how we answer questions. It shapes how we view these really complex problems. Now, the textbook is talking about three specific models or worldviews or paradigms when it comes to healthcare and health communication. One would be the biomedical kind of approach, which is classical deductive reasoning. That would look like you got something broke, you fix it, right? They would contrast this with biopsychosocial, which is pulling in the mental health stuff and the awareness of the complexity of these systems. And then they also add in sociocultural, which is pulling in more societal context. That would be more of the what's your socioeconomic standing? What kind of neighborhood did you grow up in? Race, ethnicity, all that stuff. Now, I think we could probably recognize that all of these paradigms or healthcare models are meaningful in their own ways. For example, it's tempting to really want to think about all those social determinants of health. It's a good buzzword in epidemiology, in case you're wondering, social determinants of health. But if you go into the doctor with a broken leg, you'd probably prefer they just put a cast on it rather than ask you all these complex questions about your income and your mental health and do you feel safe at home and all that. On the other hand, that's part of your doctor's job, is to determine how your health is in general, right? What kind of situation led to the broken ankle? If it's because you got pushed down the stairs by an abusive partner, well, that would be important to address too, not just fixing the broken ankle. But sometimes you just need some antibiotics because you got a sinus infection. Happens all the time, right? So each one of these models is going to have its time and place. I think what's going to be important is to recognize that and be well versed in all of them so that we can make more meaningful interventions. In particular, you want to have a doctor that has an understanding of these different times and recognizing when it's appropriate to engage each model. So we want to recognize that there are strengths of each of one of these, and maybe there isn't any one solution here. But as with most things, including health literacy, knowing more, having more knowledge and information helps us make more meaningful choices, better health choices, better choices for life. So holism is important, but so is solving problems, right? Recognizing that our health is contingent on a whole lot of other different things, that matters. But sometimes you just need to fix a broken leg. Now, the question of whether or not our system really allows for both, that's a meaningful one. I don't think that you'll find many doctors who say, nah, forget all that biopsychosocial nonsense, and just fix the broken leg. Like, most modern doctors are going to recognize that there are a lot of interacting factors. But the system, again, the complexity of the system means that it may not have the avenues to pull on those different paradigms. And so that's a meaningful question we can ask ourselves, is does our current system allow for these different paradigms to work the way we would like them to? And then we can also ask ourselves whose responsibility that is. We're all complicit in the system in our own ways, but is this more of the patient side of things? Is this more on the provider's responsibility? Well, suffice to say, We all have a role to play, and the more information we have, the more we learn, the deeper understanding we have of these factors, the better off we're going to be. Now, you might get the sense that communication people really like these kind of sociocultural perspectives and the holistic kind of approach to things. One reason for that is that it allows the flexibility to recognize that communication itself is therapeutic and can be, and plays a huge important role in social support and our health and well-being. It allows us to put things into perspective. It allows us to co-register our experience or co-orient with our other important people in our lives. And that's important for our identities, which is important for our health. And it also allows us to exercise, or by either meaning of the word, emotional stressors, and also improve our health in that way. I want to take a moment here to introduce the health belief model, changing gears a little bit, but I think it's helpful for you to recognize how this works in practice. Now, the health belief model is one of the earliest theories about health communication, and this emerged to kind of account for a lot of these different factors that might influence how a person makes their health decisions. And what's interesting about this is none of this is very complex. The figure looks a little complex for you, perhaps. But what you really want to know here is that this is kind of the first time where healthcare professionals, this was the U.S. Public Health Service, they were trying to figure out why people wouldn't take free health resources. The exact context was there were X-ray vans. They would drive to neighborhoods where people had a lot of tuberculosis, and they said, hey, get a free screening for tuberculosis. It's a very easy thing for us to fix. If we detect it, we can get you on some antibiotics and fix it. And they couldn't get people to pursue that health action. And so they were trying to find, this is like in the 50s, right? They're trying to figure out, whoa, we're scientists and we're giving them this free resource, this information. Why won't they enact it? And they couldn't figure it out. So they hired some social scientists, and this is what they came up with. Now, so again, if you look at this, it's just saying, well, you have the perceived susceptibility and perceived seriousness of the illness or health issue that we're trying to address. How does the patient view that? Do they think that they're susceptible to it? And do they think that the threat is serious? We could use tuberculosis as an example. We could use COVID as an example. How many of your family members saw that as a real threat, and a serious threat, and one that they would be exposed to? Well, that leads into our understanding of it as a threat. And there's other modifying factors, right? All these other things, whether it's our personality, our peers, our social class, that feeds into it, and so do media campaigns, right? It's not just as simple as saying, all right, we got this truck in your neighborhood, go do it. There's a couple other factors, right? And then this all leads to the perceived benefits of the action and the perceived barriers of the action, which then leads to the likelihood of pursuing the recommended health behavior, right? This is not as confusing as it looks. It's just recognizing that there are other factors here than whether or not the CDC tells you to get vaccinated or whether or not there's a truck in your neighborhood, right? There's other factors that lead to that. What do your peers have to say about that? How is the messaging on Facebook influencing? What about your favorite news channel? All of these things factor into that. So what's interesting about the health belief model is that this was the first time they thought about that, right? The 50s. Public Health Service was finally engaging with factors other than it's broken, fix it, right? And that's really important. So this is a specific model and a specific example of how health communication came about. Do you need to remember all of this? I think you can do that pretty intuitively, but we want to recognize that that was the 50s, right? That wasn't that long ago. I mean, maybe it seems like a long time to you, but there are doctors alive now who maybe were practicing not long after the 50s, or were children then, or could have been doctors back then. And this impacts us, and this kind of thinking is very important for us going forward. Now, maybe I'm making this a little more complicated than you're comfortable with. That's partially intentional, because I want us to recognize, again, going back to systems theory, the complexity of these issues. Health is not straightforward. It is not as simple, whether or not we would like it to be. It's never as simple as it's broken, fix it. Well, rarely, right? Sometimes, yeah, we can do that, but that doesn't match with our understanding of health, what it is and how we promote it. Now, I think we have a lot of hope, though. So if you find this kind of depressing, this discussion to be a little depressing, well, there's hope. And that hope is in health literacy. And I believe this very firmly, and I will endeavor to convince you of this as we go forward. What does health literacy mean? That means improving our knowledge, our understanding of health. It means practicing empathy. It means practicing critical thinking skills. We have to practice these things and engender them in others if we want to improve health outcomes, regardless of what you do to the healthcare system. And which probably should be adjusted and reformed, but it's not going to be meaningful if you don't deal with the important factors in that system. And that would be these kinds of skills. Health literacy has to do with understanding health. Okay? Health communication is all about promoting that kind of understanding, but let's think of this as a goal, and I think health outcomes will improve as well. We may think we know the answers, but if we've learned anything in the past 3 years, it's that health knowledge is a moving target. Health is not and should not be political, and anyone says different is probably a hack. A political panderer, that's not great. We don't want, and again, to some extent, it's always going to be political, and it's always going to be politicized because we use our group identities to understand the world. That's unavoidable to a certain extent, but for us as health comm scholars, we need to break that habit, fight against it, and pursue goals of health literacy. And we're going to work on that. So in the future videos, we're going to start untangling these complex topics and seeing what we can do to improve health literacy, health communication, and health outcomes. We'll practice depoliticizing all of this, but we're going to need to want to do that. So I will also be endeavoring to convince you that that's worth doing. It's easy to rely on politics and the people that we like, the news station that we like to tell us what to do, but that's not going to improve health. And if it does, it's going to be more or less random, the success rate. So that's all for today. I hope you found it interesting, and I look forward to further discussions about the topics.